What is a dangerous PSA level? When it comes to prostate health, many people wonder about the significance of the prostate-specific antigen test, commonly known as the PSA test. This test measures the level of a protein produced by the prostate gland in the blood. Elevated PSA levels can indicate various prostate issues, including cancer. However, it's important to note that high levels can also result from benign conditions like prostatitis or benign prostatic hyperplasia, which is an enlargement of the prostate. Understanding what constitutes a normal PSA level is essential. Generally, a PSA level below 4.0 nanograms per milliliter is considered normal. Some health organizations even suggest that levels below 2.5 nanograms per milliliter indicate a lower risk for prostate cancer. If PSA levels are above 4.0 nanograms per milliliter, it may prompt further investigation, such as imaging tests or a biopsy, to determine the underlying cause. Now, when we talk about a dangerous PSA level, it's crucial to clarify that this term can be misleading. PSA levels alone do not define danger. Rather, they indicate the need for additional evaluation. Levels significantly above 4.0 nanograms per milliliter may suggest a higher risk for prostate cancer or other prostate-related issues. For example, PSA levels between 4.0 and 10.0 nanograms per milliliter may lead to further testing to rule out cancer. Levels exceeding 10.0 nanograms per milliliter are more concerning and usually requiring immediate medical evaluation. Screening recommendations vary, but the American Cancer Society advises that men aged 50 and older discuss the benefits and risks of PSA screening with their healthcare provider. Those with a family history of prostate cancer may need to start these discussions earlier. Interpreting PSA results involves considering other factors, such as age, family history, and overall health. A healthcare provider will assess these factors to determine the best course of action. It's essential to remember that PSA levels are just one tool in identifying potential prostate issues. They do not definitively diagnose cancer. Therefore, if you have concerns about your PSA levels, it is vital to discuss them with a healthcare provider to ensure you receive appropriate care and follow-up.